Okay guys, let's talk about types of IV fluid and their uses. What are IV fluid? IV fluid are chemically prepared solutions that are administered to the patient, used to replace lost fluid or to aid in delivery of IV medications. So the first one here, we have the crystalloid. What are crystalloid? Crystalloid is the primary fluid used for pre-hospital IV therapy that contain electrolytes like sodium, potassium, calcium, chloride. So what are the types of this crystalloid that we have? We have the isotonic crystalloid. Here, the crystalloids contain the same amount of electrolytes as the plasma, and they do not cause significant shift of water between the blood vessels and the cells. We use the isotonic crystalloid for a person with low blood volume. What are the types of the isotonic crystalloid that we have? We have the 0.9% normal saline, we have the lactated ringers, we have 5% dextrose in water, we have 5% dextrose in 0.225 normal saline. And we also have the Daro solution, which is used for treatment of dehydration, diabetic coma, hypokalemia, metabolic acidosis. Other types of the crystalloid that we have the hypotonic crystalloid. What is an hypotonic crystalloid? It is when the crystalloid contains fewer electrolytes than the plasma, and in this case, it causes water to shift from intravascular space to extravascular space and tissues. It is used for persons suffering from dehydration and also to treat hypernatremia. What are the types of the hypotonic crystalloid? We have the 0.45% normal saline, we have 0.33% normal saline, we have 0.225% normal saline. Guys, let's talk about the hypertonic crystalloids. Here, the crystalloid contain more electrolytes than body plasma. So what happens here? It causes water to shift from extravascular space into the bloodstreams, increasing the intravascular volume. It is used for persons with low blood volume, persons with hyponatremia, and persons with increased intracranial pressure. Examples of the hypertonic crystalloid: we have the 3% hypertonic saline, 5% hypertonic saline, 10% dextrose in water, 5% dextrose in lactated ringers, 5% dextrose in 0.9% normal saline, 5% dextrose in 0.45% normal saline. Let's talk about the next IV fluid types here. We have the colloids. Colloids are IV fluid that contain solutes in the form of large proteins or other similarly sized molecules. They are used to maintain blood volume. Don't forget about that. Examples of the colloids: we have dextran, hetastarch, salt-proalbumin, plasma protein fraction. Guys, let's talk about the third one here, the blood and blood products. They are the most desirable replacement fluids that we have, used for what? Used for increasing the intravascular volume and transport of oxygen to cells. Examples of them: we have platelet, plasma, and the packed red blood cells. Guys, let's talk about the oxygen carrying solutions. They are synthetic fluid that carry and deliver oxygen to the cells, and they show promise care for patients who have experienced severe blood loss and hypovolemia. Guys, let's talk about the fifth one here, the Buffer solutions. They are used to maintain the acid-base balance. Example of them: we have the lactate, malate, acetate, gluconate, and pyruvate. Guys, let's talk about the balanced salt solutions. What are they? They are sterile physiological solutions that contain sodium chloride, potassium chloride, calcium chloride, and what? And sodium acetate. They are referred to as more physiological because their electrolyte constitution resembles that of the plasma. The commonly used balanced salt solutions: we have the lactated ringers, we have the compound sodium lactate or the Hartmann solution. So what are these lactated ringers? So the lactated ringers, they are used for volume resuscitation from blood loss and burn injuries, used in sepsis and also to cure this acute pancreatitis. So what are the Hartmann solution? The Hartmann solution, also called the compound sodium lactate, they are given to correct the low blood pressure, to treat metabolic acidosis, to restore fluid levels and normal salt balance. So you can see for yourself that we have really defined the balanced salt solutions. Let's move on to the next without wasting any of our time. Guys, the complication of the IV fluid administration. We have blood clot, cellulitis, phlebitis, skin necrosis, pulmonary edema, fluid overload, acute respiratory distress syndrome, pressure injury, abscess, and hematomas. Bye for now, guys. Please subscribe to the channel Expert Medics. Let's make more impact. Bye for now.